flavors from certain non-food items. And welcome to another episode of Disorders Uncovered. Eating clay. I'm your host, a form of pica called geophagia. On today's accepted behavior, we investigate a very disorder is most common among children and pregnant women. Pica is a compulsive eating. While there is no single cause of pica, a deficiency in iron or zinc may lead to materials often. Furthermore, in large individuals with certain very little regard for example, such as schizophrenia, those who suffer from pica compulsive have been found to may develop pica as a coping mechanism. Pica is the most common eating disorder, and even wood. Those institutionalized in mental. Some people may even enjoy and crave the textures of flavors from certain non-food. It is extremely hard to diagnose in some cultures, as there are few side effects, which can show a patient to suffer. Is an accepted behavior. This disorder is most common among children and pregnant women. While there is no single cause of pica, a deficiency in iron or zinc may lead to it. Furthermore, individuals with certain non-food items such as schizophrenia, they can damage the gastrointestinal tract, and that can result in develop pica as a coping mechanism. And pica is the most common eating disorder of those institutionalized. The most successful technique to uncover whether about 20% of the population affected is ways of circumspect. It is extremely hard to diagnose pica, as there are few side effects which can show a patient is suffering. Once a patient eats these foods, they can damage the gastrointestinal tract, and that can result in bowel problems, ulcerations, and even perforations. The most successful technique to uncover whether a patient is really suffering from pica is ways of circumspect interviewing and questioning the patient's dietary history. Another way in which to test for pica is checking the anemia levels in patients believed to have pica disorder. In order to be diagnosed with pica, the patient must eat non-food items at least once a month for a duration of time. On today's show, we welcome a young man at the age of 17 who suffers from pica. We are lucky enough to ask him about his battle with pica, when he was diagnosed, and how he coped with pica disorder. Please welcome to the show, Mr. Lucas Ellis. All right, Mr. Ellis, thank you so much for being here.
Yes, hi, I'm well. Much better in previous times.
You previously suffered from pica disorder. Could you please describe to me a normal day with the disorder?
So I was diagnosed with pica about 4 years ago. I already had it 2 years before that. On a normal day, I'd be eating normal foods and a normal schedule. However, about once a week, I had these unbelievable and sudden urges to consume non-edible items. The first time this ever occurred, I was about 11. I was at the school on the playground, and I felt the urge to eat the sand next to me where my classmates and I were playing. This was the first time I had ever eaten a food with no nutritional value and a food that's not eaten by others. I felt satisfied as my craving was taken care of. However, I was extremely embarrassed and kept to myself, not informing my parents or a friend. After this incident, I would get the cravings once a week, and without thinking of the consequences, I would eat whatever I wanted. Some days, I would eat chips of paint, soil, clay, and even mess.
So, how were you properly diagnosed? What led to doctors understanding that you actually had pica disorder?
Well, about 7 months ago, I was hit with another craving, this time to eat chips of paint. I've been eating this occasionally for 3 years prior to this incident. After I ate the chips, I started getting abdominal cramps, blurred vision, and muscle weakness. Thankfully, my mom was home, so she heard me collapse, and once she saw me, she rushed me to the hospital. The doctors at the hospital told me I had suffered from lead poisoning. I saw how pica was ruining my health and causing problems in my life. Once I left the hospital, I decided to tell my mom about my craving.
Interesting. So before we go, Lucas, do you have any advice for children and young men who are in the same position you were?
Yes, to all kids out there who suffer the same cravings I had. Well, I was in the same position. Don't let pica become as serious as it was in my life in yours. I went to the extreme and suffered a lot of pain from it. Please speak up and let your parents or a trustworthy adult know what you are going through. It will help you in the long run.
Thank you so much for coming in, Mr. Ellis.
My pleasure.
Guys, give it up for Mr. Ellis. And before we go, if any viewers out there are suffering of an eating disorder of any kind, please reach out and call this number to help get through it. Call the National Eating Disorder Hotline at 1-800-931-2237. Again, 1-800-931-2237. Thank you for watching, Good night.